Spear shape. So this spear-shaped head of the femur articulates with the acetabulum of the hip bone to form this hip joint. Like coming to the second diagram, see, this is this depression over here in the hip bone, it is the acetabulum. And this acetabulum, when you observe the outer surface, can you see a half moon shaped one over there? It is clearly visible in the diagram. In this depression, in the hip bone, this depression is called as acetabulum. So in this, clearly it is marked over here, half moon shaped one. Can everyone see this? It is labrum, called as acetabular labrum. Because of presence of this acetabular labrum in the acetabulum, the depth of this acetabulum is increased, and moreover, when you observe the circumference of the acetabulum and the circumference of the head of the femur, the circumference of head of the femur is much larger when compared with the acetabulum. So, if it is like that, what happens is there is a chance of dislocation of the hip joint. In order to stabilize this joint, this labrum is there over there. It stabilizes the hip joint, and moreover, head of the femur is fixed into this acetabular labrum, and it doesn't allow this head of the femur to dislocate. Am I clear regarding this articular surfaces? Mainly there are two articular surfaces. What are they? One is head of the femur and another is acetabulum. Another is acetabulum, which is seen in the hip joint. And this acetabulum on the outer contact, you will see a half moon shaped rim called as acetabular labrum. It stabilizes the joint. Am I clear up to this regarding the articular surfaces? Now coming to the next stage. Factors which are maintaining the stability of the hip joint. Now, can anyone say what are the factors which are maintaining the stability of this hip joint?
Ligaments, sir.
Okay, good. Who's this? Someone said ligaments. Who's this? Good. Apart from ligaments, anything else? Anything else? There are a lot of things which are seen around this hip joint. So everything has a role. It plays its own role to stabilize this hip joint. Like the depth of the acetabulum. Just now I have shown you the acetabulum. When you observe the acetabulum, the depth of the acetabulum as well as the acetabular labrum, they play their own role to stabilize this joint. Like that, the ligaments. There are around 7 ligaments which are seen in front of the joint, behind the joint, and some ligaments are covering the entire joint. Like fibrous capsule, it covers the entire joint. Iliofemoral and pubofemoral ligaments, which are seen on the anterior aspect of the joint. Istiofemoral ligament, which is seen on the posterior aspect of the joint. Like that, the transverse acetabular ligament is there, which is seen in the lower part. It also stabilizes the joint. Like that, there is a ligament which is being attached between the transverse acetabular ligament and the fovea capitis of the head of the femur, called as ligamentum teres. So all these ligaments which are seen around and in front and behind this hip joint, they play a key role in maintaining the stability of the joint. Like that, muscles. When you observe your hip joint, see anteriorly you are seeing the femoral triangle, posteriorly you are seeing the gluteal region. On the side you are seeing this lateral aspect of the thigh. Like that, on the medial aspect, adductor group of muscles. So all these muscles, they also play a key role in stabilizing this joint. Like that, the length and obliquity of the neck of the femur. Like when you observe the neck of the femur, Between the head of the femur and shaft of the femur, you will see this neck of the femur. It is situated at an oblique angle. Usually it is 150 degrees in children and 125 degrees in adults. It is called as neck shaft angle of femur. It also plays an important key role in maintaining the stability of this joint. Like that, along with this, the atmospheric pressure which is situated over there also maintains a key role in maintaining the stability of the joint. So am I clear regarding the factors maintaining stability of the joint? It is asked as a short answer. And if it is asked as a short answer, you have to write all these 5 points and you have to explain about them. Am I clear? The depth of the acetabulum as well as the ligaments, around 7 ligaments are there. Some are situated around the joint, some are situated in front of the joint, some are situated on the posterior aspect of the joint, some are situated within the joint. All these ligaments play their key roles. Like that, the muscles. Like anteriorly, we see the muscles which are forming the floor of the femoral triangle. Like 4 muscles are there forming the floor of the femoral triangle. What are they? Adductor longus, pectineus, iliacus, and psoas major. Like that, posteriorly, we see gluteal group of muscles. What are they? Gluteal group of muscles. Already gluteal.
Maximus, minimus, minimus.
Okay. Another question. Structures undercover gluteus maximus. Can anyone say this? Already class is completed.
Gluteus medius.
Gluteus medius. Minimus.
Minimus.
Medius.
Piriformis.
Piriformis. Obturator externus. Tendon of obturator externus.
Quadratus femoris.
Quadratus femoris.
Tensor fascia lata.
Tensor fascia lata. దీనికి ఎన్ని ఉంటుందమ్మా gluteus maximus అనేది lateral aspect లో ఉంటుంది. Gluteus maximus can obturator internus with 2 gemelli muscles. See this structures undercover gluteus maximus is asked as a short answer, and moreover, if practical we keep this specimen, gluteus maximus specimen పెడతాం. అప్పుడు definitely will ask this. మీకు చౌరాశిలో he has clearly given this. Read this. Already theory class అయిపోయింది. Structures undercover gluteus maximus. If I am not wrong, Rajesh has taken this. So simple. Structures undercover gluteus maximus అని అడిగినప్పుడు సింపుల్ థింగ్. మెయిన్ గ్లూటియల్ గ్రూప్ ఆఫ్ మజిల్స్ ఏంటి? గ్లూటియస్ మీడియస్ మినిమస్. తర్వాత టెండన్ ఆఫ్ ఆపరేటర్ ఎక్స్టర్నస్, ఆపరేటర్ ఇంటర్నస్ విత్ 2 gemelli muscles. తర్వాత అక్కడే sciatic nerve వస్తుంది. You will see this superior gluteal vessels and inferior gluteal vessels. Piriformis. When they are seen under top is gluteus maximus. Just after this class, open your book, just go through the structures under top gluteus maximus. It is asked as a short answer. Now, muscles anteriorly we see these muscles which are forming the floor of femoral triangle. Alage posterior gluteal group. Medial adductor group of muscles. And laterally, you will see this tensor fascia lata in that chapter like this. So these are the factors which are maintaining the stability of the joint. You are having your book with you. Talk and process for me. It is asked as a short answer. University exam, the factors maintaining the stability of the joint. So after this, ligaments. Now, how many ligaments are there? Can anyone? Right, very good. Can anyone say the names of them?
Fibrous capsule.
Very good.
Transverse acetabulum ligament.
Okay. Okay, this is 43.
Iliofemoral ligament.
Iliofemoral. Okay. 19 Bhavani Reddy. Okay. What you're saying is good. We'll see them in details. Fibrous capsule, iliofemoral ligament, pubofemoral ligament, istiofemoral ligament, ligament of head of the femur, this acetabular labrum and transverse acetabular ligament. Total 7 ligaments are there. So all these ligaments, they maintain the stability of the joint, like fibrous capsule, capsule, fibrous capsule. So this capsule encloses the entire joint. Joint అంతటిని కూడా enclose చేసి ఉంచుతుంది and it is fibrous in nature. Next, second one observe చేయండి, iliofemoral ligament. Clearly it is the name itself is saying its attachments. అలాగే third one, and I will say ప్రతి ligament ని కూడా detail గా I will speak. Just I am talking about this ligaments first. Pubofemoral ligament. And observe చేయండి, the name itself is speaking about its attachments. Pubofemoral ligament. Next, fourth one, istiofemoral ligament. Observe చేయండి, istiofemoral ligament. Attachments clear on that. Next, ligament of head of femur. అది ఎక్కడ ఉంటుందో క్లియర్ గా అక్కడ ఉన్న పేరులోనే ఉంది. ligament of head of femur, also called as ligamentum teres. Next, acetabular labrum. Last one, transverse acetabular ligament. Now we will see details of these ligaments. First one, fibrous capsule. This fibrous capsule, it is seen around this entire hip joint. It is stronger and thicker. It is made up of a fibrous sheath enclosing the entire hip joint. It has a medial attachment and lateral attachments. Observe చేయండి ఇక్కడ క్లియర్ గా డయాగ్రామ్ when you are observing. దాంట్లో చూడండి, medial గా hip joint is, hip bone is there, lateral గా femur is there. So medial attachment అంతా కూడా hip bone మీద వస్తుంది. Lateral attachment will be seen on femur. Now we will see about the attachments of this. Medially, it is attached to the margins of acetabulum. This is the acetabulum. Clearly, I am showing you with cursor. Clearly, about this edge. This is the edge of the acetabulum. So medially, this fibrous capsule is attached to the margins of the acetabulum. అలాగే ఇక్కడ acetabulum కింద you will see transverse acetabular ligament. The fibrous capsule is attached to the transverse acetabular ligament also, and adjoining parts of this operator foramen. ఇక్కడ చూడండి కొంచెం lateral గా కింద వైపు you will see this operator foramen, adjoining margins of the operator foramen. మళ్ళీ చెప్తున్నాం regarding the medial attachment. Medially, this fibrous capsule is attached to the margins of the acetabular labrum and the transverse acetabular ligament. కింద వస్తుంది అక్కడ acetabular labrum మీద హాఫ్ మూన్ షేప్ ఉంటే హాఫ్ మూన్ ది కింద గ్యాప్ వస్తుంది కదా, ఆ రెండు ఎడ్జెస్ మధ్యలో you will see the transverse acetabular ligament. అలాగే the margins of the operator foramen. Now coming to the lateral attachments. Lateral attachment will be attached to femur. Femur మీద ఎక్కడ అటాచ్ అవుతుంది? It is attached to intertrochanteric line. ఫీమర్ లో తీసుకుంటే యాంటీరియర్ గా రెండు ట్రోకాంటర్ల మధ్యలో ఇంటర్ట్రోకాంటరిక్ లైన్ ఉంటది, వెనక వైపు చూస్తే ఇంటర్ట్రోకాంటరిక్ క్రస్ట్ ఉంటుంది. సో యాంటీరియర్ గా ఇట్ ఈస్ అటాచ్డ్ టు ద ఇంటర్ట్రోకాంటరిక్ లైన్ ఆఫ్ ఫీమర్. అలాగే పోస్టీరియర్ గా తీసుకుంటే ఇంటర్ట్రోకాంటరిక్ క్రస్ట్ ఉంటుంది. ఇక్కడ చూడండి డయాగ్రామ్ లో వెనక వైపు నుంచి ఇచ్చాడు. హియర్ యు ఆర్ సీయింగ్ దిస్ ఇంటర్ట్రోకాంటరిక్ క్రస్ట్ బిట్వీన్ ద గ్రేటర్ ట్రోకాంటర్ ఆఫ్ ఫీమర్ అండ్ లెస్సర్ ట్రోకాంటర్ ఆఫ్ ఫీమర్ వెనక వైపు. సో వెనక వైపు ఎక్కడ అటాచ్ అవుతుంది? జస్ట్ ప్రాక్సిమల్ టు ద ఇంటర్ట్రోకాంటరిక్ క్రస్ట్ అన్నట్టు. అంటే ఇంటర్ట్రోకాంటరిక్ క్రస్ట్ కి కొంచెం పైన వైపు అటాచ్ అవుతుంది. Am I clear regarding the attachments? మళ్ళీ చెప్పాలా? ఫైబ్రస్ క్యాప్సూల్ సింపుల్ థింగ్, ఈజీగా గుర్తుండడానికి క్యాప్సూల్ అన్నప్పుడు ఎప్పుడు ఉంటాయి. ఇట్ ఎన్క్లోజెస్ ద ఎంటైర్ జాయింట్. ఫైబ్రస్ క్యాప్సూల్ అన్నాడు కాబట్టి ఇట్ ఇస్ మేడ్ అప్ ఆఫ్ ఫైబ్రస్ టిష్యూ. అక్కడికి రెండు పాయింట్స్ కవర్ అవుతాయి. నెక్స్ట్ థింగ్, ఇట్ ఇస్ స్ట్రాంగర్ అండ్ థిక్కర్. క్యాప్సూల్ కాబట్టి దానికి అటాచ్మెంట్స్ ఉండాలి. మీడియల్ గా అటాచ్మెంట్ ఉంటుంది, అలాగే లాటరల్ గా అటాచ్మెంట్. మీడియల్ గా ఎక్కడ హిప్ బోన్ మీద ఉండాలి, లాటరల్ గా ఎక్కడ ఉండాలి ఫీమర్ మీద ఉండాలి. ఫస్ట్ విల్ సీ ద మీడియల్ అటాచ్మెంట్స్. Medially, it is attached to the margins of acetabular labrum and transverse acetabular ligament. అక్కడే కింద ఆపరేటర్ ఫొరామెన్ వస్తుంది అండ్ ద మార్జిన్స్ ఆఫ్ ఆపరేటర్ ఫొరామెన్ అయిపోయింది. లాటరల్ గా అటాచ్మెంట్స్ చూద్దాం. లాటరల్ గా ఫీమర్ లో యాంటీరియర్ ఆస్పెక్ట్ లోని పోస్టీరియర్ ఆస్పెక్ట్ లోని అటాచ్ అవుతుంది. యాంటీరియర్ ఆస్పెక్ట్ లో ఎక్కడ అటాచ్ అవుతుంది? అటాచ్డ్ టు ఇంటర్ ప్రొకాంట్రిక్ లైన్. పోస్టీరియర్ ఆస్పెక్ట్ లో యూ విల్ సీ ఇంటర్ ప్రొకాంట్రిక్ క్రస్ట్. పోస్టీరియర్ ఆస్పెక్ట్ లో అటాచ్మెంట్ ఎక్కడంటే జస్ట్ ప్రాక్సిమల్ టు ఇంటర్ ప్రొకాంట్రిక్ క్రస్ట్. Am I clear regarding this? ఇంకొక పాయింట్ ఏంటంటే ఈ స్లైడ్ లో లాస్ట్ 2 పాయింట్స్ చూడండి. This capsule encloses the femoral neck. So femoral neck is intracapsular. Femoral neck is intracapsular. Just give me a second. I have to attend it. Oh no. ఒక్కసారి నాకు వీడియో కాల్ చేయమన్నాను కదా, ఒక్క సెకండ్ వీడియో కాల్ చేయి. జస్ట్ 2 minutes. అగైన్ ఐ విల్ కమ్ ఆన్ లైన్. మ్యూట్ చేస్తున్నాను. జస్ట్ ఐ హావ్ టు అటెండ్ ఎ ఫోన్ కాల్. ఇట్ ఇస్ ఇంపార్టెంట్ వన్. Hello. So am I visible, audible?
Yes, sir.
Okay, sorry for this. I have to attend an important call, so that I have gone offline. Now, coming to this, కింద 2 పాయింట్లు చూడమ్మా. ఆల్రెడీ ఫిమోరల్ నెక్ చెప్పాను, ఇంట్రా క్యాప్సులర్. సీ హియర్ బ్లూ కలర్ కనిపిస్తుంది క్యాప్సూల్, అండ్ నెక్ ఇస్ ఇన్సైడ్ ద క్యాప్సూల్, సో ఇట్ ఈస్ ఇంట్రా క్యాప్సులర్. లైక్ దట్. Observe the greater trochanter and lesser trochanter. They are outside the capsule, so it is extracapsular. So after fibrous capsule, am I clear regarding this? Is it clear for everyone regarding the fibrous capsule? And this fibrous capsule is asked as a 3 marks question. It is asked as a 3 marks question. Now coming to the next ligament. Before going to next ligament, ఇక్కడ చూడండి diagram లో, here clearly the attachments of this capsule are shown over here. పైన నేను I am focusing the cursor. ఇక్కడ clear గా ఇక్కడ ligaments of the joint capsule and రాసి ఉంది. Cut section here you can see its attachment to the margins of the acetabulum. Like that, its attachment on the femur. Cut section లో clear గా కనిపిస్తుంది. Next thing, ఇందాక I forget to say one point. Articular surfaces చెప్పాను. So articular surfaces, mainly 2 surfaces are there. What are they? What are the articular surfaces which are participating in this? Right? Head of the femur and acetabulum. They are covered with cartilage. ఇందాక point చెప్పడం మర్చిపోయాను చెప్తున్నప్పుడు. Here in this diagram it is clearly visible. See this blue colored one. It is, which cartilage is covering this articular surfaces?
Hyaline.
Good. It is hyaline cartilage. Now clearly observe, acetabulum చూస్తే మొత్తం కూడా hyaline cartilage clear గా blue color గా కనిపిస్తుంది ఇక్కడ. అలాగే head of the femur కూడా చూస్తే you can clearly see it is covering with hyaline cartilage. Here in the center of the head of the femur you will see a depression called as fovea capitis, where this ligament of head of the femur is attached. Akkada it is devoid of cartilage. You will not see cartilage in that particular area. So akkada white on the ligament attached to remaining part anta it is bluish in color. Now after this ligament, coming to the next ligament, iliofemoral ligament. Observe the name, iliofemoral ligament. The attachments of this ligament is clearly said in the name. One attachment is seen on the ilium and another attachment is seen on the femur. This iliofemoral ligament is an anterior ligament. It is an anterior ligament. Next thing, this ligament is also called as ligament of Bigelow. It is also called as ligament of Bigelow. Coming to the shape of this ligament, it is triangular in shape, or some others they say it is inverted Y-shaped ligament. ఇక్కడ చూడండి clear గా diagram లో కనిపిస్తుంది. Inverted Y-shaped ligament or triangular ligament, also called as ligament of Bigelow. And another thing is, it is one of the strongest ligaments in the body. ఎందుకు strongest అన్నా అంటే mainly this ligament helps to keep you in erect posture along with tubofemoral ligament and 2 muscles. Those muscles are నేను మన previous class లో చెప్పాను. muscles మీకు గుర్తున్నాయో లేదో పేరు. Can anyone say those names? Femoral triangle చెప్తున్నప్పుడు I have mentioned those names. ఆ 2 muscles పేర్లు చెప్పారు. erect posture maintain చేయడానికి. Mainly these are the muscles, iliacus and psoas major. So along with those muscles, these 2 ligaments, they act to keep our body in erect posture. The ligaments are, one is iliofemoral ligament and another is tubofemoral ligament. Now, it is triangular in shape or inverted Y shape ligament. It has an apex which is directed upwards and a base which is directed downwards towards the femur. Now coming to the attachments. Apex is attached to anterior, inferior iliac spine. The clear which one diagram of కనిపిస్తుంది when you observe. Apex is attached to anterior, inferior iliac spine. Whereas coming to the base is attached to intertrochanteric line. While running downwards, this ligament divides into two sleeves, and these two sleeves they are attached to base of the intertrochanteric line. And this ligament reinforces this joint anteriorly. So am I clear regarding this iliofemoral ligament? Simple thing. Iliofemoral ligament. It is seen on the anterior aspect of hip joint. It is also called as ligament of Bigelow. It is coming to the shape, it is triangular in shape or inverted Y shape. It is one of the strongest ligaments in the body. Regarding its attachments, on the hip it is attached to anterior inferior iliac spine. On the femur it is attached to base of the intertrochanteric line. While running downwards, this ligament divides into two slips, and those two slips are attached to base of intertrochanteric line. Correctly, hardly 6 to 7 points, and if you can remember this, you can write about iliofemoral ligament. And next thing, this ligament is also asked as a short answer. So after iliofemoral ligament, once I will show you this diagram over here. So in a clear diagram, when you observe this, you can clearly see its attachments. Upper hip bone, the it is attached to anterior inferior iliac spine. While running downwards, it is divided into two slips and they are attached to the center for contact line. Clearly understood. So after this, we'll proceed to another ligament. Am I clear regarding this iliofemoral ligament? Okay. Now coming to the next ligament, pubofemoral ligament. Observe the name. Name itself is speaking about its attachments. Pubofemoral ligament. This pubofemoral ligament is also seen on the anterior aspect of the ligament, and it supports this joint infерomedially. Coming to the shape of this ligament, it is triangular in shape. It also has a medial attachment and lateral attachment. Both superior and inferior attachments. Medial and superior hip bone may attach to the inferior or lateral attachment and femur may attach. That is the difference. Now, superiorly, it is attached to iliopubic eminence, E part, iliopubic eminence. Sorry, this one. Iliopubic eminence and obturator crust. Obturator foramen pine, you will see a crust called as obturator crust. So, regarding its attachment of the hip bone, iliopubic eminence and obturator crust, these fibers, they run downwards, inferiorly and downwards. And some fibers, they merge with the iliofemoral ligament. Some fibers, they merge with iliofemoral ligament. And merges with the capsule of the hip joint also. Am I clear regarding pubofemoral ligament? Simple again. It is seen on the anterior aspect. Name itself is saying its attachments. Yes, medial attachment is on the pubic bone. Lateral attachment is on the femur. Pubic bone may attach to the iliopubic eminence and the next obturator crust. Whereas lateral attachment, the fibers merge with this iliofemoral ligament as well as fibrous capsule. Am I clear regarding this ligament? After this, coming to the next ligament, ischiofemoral ligament. This ischiofemoral ligament is seen on the posterior aspect of the ligament, so of the hip joint. Again, పేర్లో ఉంది ఇస్టియోఫిమోరల్ లిగమెంట్. అటాచ్మెంట్స్ క్లియర్ గా ఉన్నాయి. మీడియల్ గా ఇస్టియం మీద అటాచ్ అవుతుంది. ఎక్కడ అటాచ్ అవుతుంది? పోస్టో ఇన్ఫీరియర్ టు ఎస్టాబులం. ఇట్ ఈస్ అటాచ్డ్ టు ద ఇస్టియం, జస్ట్ పోస్టో ఇన్ఫీరియర్ టు ద ఎస్టాబులం. అలాగే లాటరల్ గా అటాచ్మెంట్ చూడండి. లాటరల్లీ is attached to greater trochanter deep to iliofemoral ligament. After this is a little weaker ligament when compared with the anterior ligaments. Anterior ligaments in that already chosen pubofemoral and iliofemoral. This istiofemoral is a posterior ligament and it is little weaker when compared with the anterior ligaments. So after this, coming to the diagram, you can clearly see the istiofemoral ligaments. Now, ligamentum teres or ligament of the head of the femur. Regarding the shape of this ligament, it is triangular in shape, has a medial attachment and lateral attachment. Laterally, it is attached to fovea capitis, which is a depression seen in the head of the femur. Medial, this flat band is attached to transverse vestibular ligament. Vestibular labrum ఇందాక మనం మాట్లాడుకున్నాం. Vestibulum పైకి వైపు హాఫ్ మూన్ షేప్ లో ఉంటుంది. దాని కింద వైపు హాఫ్ మూన్ షేప్ లో ఉన్న ఈ రెండు ఎడ్జెస్ కి ఇట్ ఇస్ బ్రిడ్జ్డ్ బై దిస్ transverse vestibular ligament. So this ligament of head of femur is attached to transverse vestibular ligament. Next, there is an artery which will be passing through this ligament and supplies the head of the femur. It is acetabular branch of obturator artery. Am I clear? Is it clear regarding ligamentum teres? Ligamentum teres is also asked as a short answer. After ఇక్కడ చూడండి ఈ డయాగ్రామ్ ఇంకా క్లియర్ గా తెలుస్తుంది. Ligamentum teres. It is triangular shaped ligament and flat band. It has a medial attachment and lateral attachment. Lateral it is attached to head of the femur. The cut section of this ligament cut chase చూపిస్తున్నాడు ఈ diagram. Laterally it is attached to the fovea capitis of the head of the femur. Medially it is attached to this transverse acetabular ligament. Clear గా కనిపిస్తుంది. And clear గా observe చేస్తే center of this you can see a red spot. An artery which is passing through this ligament called as acetabular branch of obturator artery. Okay, in the diagram, the obturator foramen, the obturator artery is there, and it is giving a branch which is passing like this and entering into this head of the femur, ligament of head of the femur, and supplying this head of the femur. After this ligament, acetabular labrum. In the diagram, the second diagram, you can clearly see this acetabular labrum. And the edges of this acetabular labrum are being bridged by transverse acetabular ligament. This acetabular labrum is a C-shaped fibrocartilaginous collar which is seen near the edge of the acetabulum. Because of its presence, the stability of the hip joint will be enhanced. So after acetabular labrum, transverse acetabular ligament. This transverse acetabular ligament, ఇక్కడ arrow పెట్టి చూపిస్తాడు clear గా. It bridges the lower edges of this acetabular labrum. The ligament converts this notch into a tunnel through which the blood vessels and nerves which are supplying this joint enters. ఈ వెనక వైపు నుంచి ఎంటర్ అవుతాయి. ఈ ligament వచ్చాక ఈ ligament రానంతసేపు you can see this half moon shaped acetabular labrum. తర్వాత ఈ ligament it is bridging between these two edges of the acetabular labrum, and the vessels which are passing to supply this hip joint pass from the posterior aspect. In the previous diagram lo kuda we can see that. ఇక్కడ arrow ఇచ్చాడు క్లియర్ గా చూపిస్తానికి. నెక్స్ట్ డయాగ్రామ్ లో ఇక్కడ కూడా కనిపిస్తుంది. ఈవెన్ ఇక్కడ కూడా ఇక్కడ బాగా తెలుస్తుంది చూడండి. ఈ వెసల్స్ వెనక వైపు నుంచి పాస్ అవుతున్నట్టు. Now after this, coming to the relations. Before going to relations regarding the ligaments, is it clear? Regarding the ligaments, okay. Now coming to the relations. Relations will study under simple four headings. Anterior relations, posterior relations, superior relations, inferior relations. Easy understanding, we will divide them into 4 steps. So, make Chaurashya of the book which you are reading, there a diagram is given. A diagram. If you practice this diagram, entire relations answer is there in this diagram. Even exam lo అడిగినప్పుడు కూడా hip joint you have to draw this diagram. డ్రా చేస్తే రిలేషన్స్ అన్ని కూడా ఈ ఆన్సర్ లో అబ్జర్వ్ చేయండి ఇదే డయాగ్రామ్ లో. ఫస్ట్ ఐఎమ్ స్పీకింగ్ యాంటీరియర్ రిలేషన్స్. ఇక్కడ నేను కర్సర్ ఎక్కడ పెడుతున్నాను చూడండి. ఆల్ దీస్ ఆర్ ద యాంటీరియర్ రిలేషన్స్. సింపుల్ మనలో చూసుకున్నా వెన్ యూ అబ్జర్వ్ యాంటీరియర్ రిలేషన్స్ ఆఫ్ హిప్ జాయింట్ ఏముంది, ఫ్రంట్ యాంటీరియర్ ఫ్లోర్ ఆఫ్ ద ఫిమోరల్ ట్రయాంగిల్ ఉంటుంది. సో అక్కడ వచ్చే మజిల్స్ అన్ని యూ కెన్ సే దే ఆర్ ఇలియాకస్ అండ్ సాస్ మేజర్. ఇది పెట్టండి, నేను కర్సర్ పెట్టాను చూడండి. ఇలియాకస్ అండ్ సాస్ మేజర్ అండ్ బర్సా విచ్ ఇస్ సీన్ ఓవర్ దేర్. అలాగే వాటికి కొంచెం ఇదిగా పక్కకి పెక్టీనియస్. ఆఫ్టర్ దట్ ద మీడియల్ ఫైబర్స్ ఆఫ్ ద పెక్టీనియస్. ఆఫ్టర్ దట్ బ్రాంచ్ స్ట్రక్చర్స్ ఫిమోరల్ వెయిన్, ఆర్టరీ అండ్ నర్వ్. అండ్ ద అప్పర్ ఫైబర్స్ ఆర్ ద స్ట్రైట్ ఫైబర్స్ ఆఫ్ రెక్టస్ ఫిమోరిస్. సో ఇవన్నీ దే ఆర్ ఫార్మింగ్ ద యాంటీరియర్ రిలేషన్స్ ఆఫ్ హిప్ జాయింట్. మళ్ళీ చెప్తాను సింపుల్. Straight head of rectus femoris, iliacus and psoas major, and a bursa which is seen over there. Alage medial fibers of pectineus and these things. And femoral vein, artery, and these are the anterior relations. Coming to the posterior relations. Posterior relations వచ్చి the tendon of obturator externus, cursor between tendon of obturator externus covered with quadratus femoris muscle. Alage this obturator internus with 2 gemellae muscles and piriformis. They form the posterior relations. Madi cheptum. Tendon of obturator externus covered with the quadratus femoris. Obturator internus with gemellae muscles and piriformis. They form the posterior relations. Now, inferior relations చూద్దాం. Inferior relations are mainly this obturator externus and lateral fibers of pectineus. They form the inferior relations. Superior relations. Superior relations వచ్చి this reflected head of rectus femoris, ఈ lateral most part, ఈ part కర్సర్ పెట్టాను కదా, reflected head of rectus femoris which is covered by this gluteus medius. So these are the relations: anterior relations, posterior relations, superior and inferior relations. After that, blood supply. Like mainly the blood supply to this hip joint is from the branches of this femoral artery and obturator arteries. This femoral artery చెప్పుకున్నప్పుడు we have read about medial circumflex femoral artery, lateral circumflex femoral artery, whether you remember it or not. ఇక్కడ చూడండి అదే కనిపిస్తున్నాయి డయాగ్రామ్ లో. మీడియల్ సర్కంఫ్లెక్స్ ఫిమోరల్ ఆర్టరీ, lateral circumflex femoral. These femoral arteries, they wind around this neck of the femur. మీ పేర్లోనే ఉన్నాయి, మీడియల్ సర్కంఫ్లెక్స్ ఫిమోరల్ ఆర్టరీ ముందు వైపు నుంచి రౌండ్ చేస్తుంది, lateral circumflex femoral artery వెనక వైపు నుంచి రౌండ్ చేస్తుంది. సో ఈ నెక్ ఆఫ్ ద ఫీమర్ ని రెండు వైపుల నుంచి బైండ్ చేస్తూ దే గివ్ సమ్ బ్రాంచెస్. ఇక్కడ అబ్జర్వ్ చేస్తే డయాగ్రామ్ లో యూ కెన్ క్లియర్లీ సీ దోస్ బ్రాంచెస్. దీస్ బ్రాంచెస్ దే పియర్స్ దిస్ ఫైబ్రస్ క్యాప్సూల్, pass below the fibrous capsule, and from there they are called as retinacular arteries. ఇక్కడ పైన పేరు కూడా ఇచ్చారు చూడండి. They are called as retinacular arteries and they supply this entire hip joint by dividing into groups like superior group, anterior group, inferior group, all divide out. So they supply this entire hip joint. Along with this, head of the femur, already there is a branch which is supplying acetabular branch of obturator artery. So like this entire blood supply is there. Blood supply is clear, simple. branches of femoral artery and branches of obturator artery are supplying this hip joint. Medial circumflex femoral artery is there, lateral circumflex femoral artery is there. Those arteries use branches which pierce this fibrous capsule and they are called as retinacular arteries. These retinacular arteries, they are divided into groups: superior group, anterior group, and inferior group. They supply blood to this hip joint. Along with this, vestibular branch of obturator artery also supplies the hip joint. Is it clear? No, after arterial supply. Nerve supply. Mainly by four nerves. Femoral nerve, anterior ga pix istundi. Anterior division of obturator nerve, medial ga istundi. Accessory obturator nerve gives also twigs, and nerve to quadratus femoris. All these nerves use twigs and supply this hip joint. No, after this, movements. Mainly we see movements like flexion, extension, adduction, abduction, medial rotation, lateral rotation, and subconduction. Like flexion of this hip joint is produced by mainly psoas major and iliacus muscles. Like that, extension is produced by gluteus maximus and hamstring muscles. Alage adduction, adductor group of muscles like adductor longus, brevis, magnus. Abduction is mainly by gluteus medius and minimus. Medial rotation, which it is through this tensor fasciae lata and gluteus medius and minimus muscles. Lateral rotation, which in this obturator group of muscles are there. Obturator internus, externus. Next to gemelli muscles are there and quadratus femoris muscles. Next, applied anatomy. Regarding the applied anatomy, you might have heard of this total hip replacement surgeries. Older age people usually they do this hip replacements. Usually they scoop out this head of the femur and neck of the femur. Trochanters avi ekkunna shaft avi akkada they will scoop out the things. And alage they will scoop out some part of the acetabulum also. And these implants will be lodged. Implants ki acetabulum మీద పెట్టేది acetabulum component అంటాం. అలాగే ఇక్కడ femur లో పెట్టేది femoral component అంటాం. They will keep those implants and they will do this hip replacement surgery. Alage hip replacement surgery, there is a clinical condition called coxa vira. ఈ X-ray news, can anyone say what is coxa vira clinical condition? ఇందాక నేను ఒక పాయింట్ చెప్పాను, నెక్ షాఫ్ట్ యాంగిల్. సో వాట్ ఈస్ నెక్ షాఫ్ట్ యాంగిల్? What is neck shaft angle? Neck shaft angle is an angle which is formed between the neck of the femur and shaft of the femur. It is 150 degrees in children and 125 degrees in adults. So in this clinical condition called coxa vira, the neck shaft angle will be reduced. This is a normal one. Right side, left side, you can see the difference. Neck shaft angle will be reduced. Next, osteoarthritis. What is osteoarthritis? Already previously first class sir meeku anatomy, general anatomy చెప్తున్నప్పుడు చెప్పాను ఈ పాయింట్, whether you remember it or not. Osteoarthritis is a clinical condition where the joint space is reduced. The joint already it is marked with an arrow showing that the joint space is reduced over here. So after osteoarthritis, Pearl's disease. It is destruction and flattening of the head of the femur with increased joint space. Osteoarthritis lo తగ్గిపోతుంది space, joint space. Pearl's disease lo joint space increase అవుతుంది, దాంతో పాటు you will see destruction and flattening of head of the femur. That is the difference. Next, another thing, Shelton's line. Usually in normal anatomy, this yellow dotted line shown, the upper border of the obturator foramen will be in same line with the neck shaft angle of the femur. It is called as a Shelton's line. In abnormal ones, it will be different. It will not be in the normal position. Shelton's line is the if you draw an imaginary line between the upper border of the obturator foramen and neck shaft angle, you will see them in a straight line, or in straight line is a curved line. Curve will be in this line, same pattern. Whereas in an abnormal one, this curve will not be there and it will be disturbed. It is called as Shelton's line. Next, dislocations of this hip joint. Usually, posterior dislocations are common, whereas the anterior dislocation is less common and central dislocations are rare. Posterior dislocations usually they appear like this. Patient will be complaining of a trauma or any injury to the hip joint, pain in the hip joint, inability to move his like numbness and tingling sensation over there. When a patient will complain of these things during this dislocations. Next, fractures of this hip area. Usually you will see the head fractures, neck fractures, trochanteric fractures and shaft fractures. I'm not going into details of these fractures. Further in your final year postings, orthopedics, they will deal with them. Details you will be bored of this class extend. So I don't want to extend this by going into details of this. Further you will read them when you're posted in this orthopedics postings. Appudu daka simple thing, fractures ఆ ఏరియాలో ఎక్కడెక్కడ అవుతాయి అంటే యూజువల్ గా హెడ్ ఫ్రాక్చర్స్ అవ్వచ్చు, నెక్ ఫ్రాక్చర్స్ అవ్వచ్చు, ట్రోకాంట్రిక్ ఫ్రాక్చర్స్ అవ్వచ్చు, షాఫ్ట్ ఫ్రాక్చర్స్ అవ్వచ్చు. ఇవి గుర్తుంచుకోండి. యూజువల్ గా ఫస్ట్ 3 హెడ్, నెక్, ట్రోకాంట్రిక్ ఫ్రాక్చర్స్ older people when they fall in these bathrooms and everything, you will see those type of fractures. They are also called as bathroom fractures. So this slide is showing that repair of these fractures. Again, they will be dealing in this orthopedics usually and screwing, plating, nailing. There are different steps over there. So you can observe just first they have plated it, and screws are fixing this plate over here, fixing the shaft. Alage paina neck and kuda stabilize cheyadaniki they have screwed it. So this is how the fractures are repaired of these areas. Next, tuberculosis of hip joint. Usually tuberculosis of hip joint the severe pain, referred pain will be seen in the knee joint also. The reason is because of same nerve supply, obturator nerve is there. అవతల హిప్ జాయింట్ కి సప్లై చేస్తుంది, కిందల్లి నీ జాయింట్ కి సప్లై చేస్తారు. బికాస్ ఆఫ్ దట్ రీజన్. ఇంకొకటి ఇది మొన్న చెప్పలేదమ్మా నేను, సాస్ మేజర్ మజిల్ చెప్పాను, ఫిమోరల్ ట్రయాంగిల్ చెప్పినప్పుడు. ఇట్ ఈస్ క్లినికల్ ఆస్పెక్ట్ ఆఫ్ దిస్ సాస్ మేజర్ మజిల్. యూజువల్ గా సాస్ మేజర్ మజిల్ కి యాబ్సెస్ వస్తే యూజువల్లీ ఇట్ విల్ బి సీన్ ఇన్ ద లోవర్ పార్ట్ వేర్ ఇట్ ఈస్ ఇన్సర్టెడ్. అక్కడ వచ్చినప్పుడు యూ విల్ బి సీయింగ్ స్వెల్లింగ్ యాజ్ వెల్ యాజ్. సో ట్రీట్మెంట్ ఇస్ సింపుల్ థింగ్. First, you can identify it by its tenderness, pain in that area, and also they will go for this X-rays. Nowadays, this ultrasound is there. They will go for that, and once the diagnosis is completed, drainage, incision and drainage of this sauce abscess, along with antibiotics and painkillers. Treatment. So this is about the hip joint. Any doubts? Any doubts regarding the hip joint? Hip joint is asked as a long question as well as short questions in the theory. Practical slow kuda we keep a specimen over here. Gluteal region specimen bedtam. So read thoroughly about this hip joint. If you are having any doubts, you can contact me. So any doubts? So is it clear for everyone? Thank you. So this I'm concluding my class. Thank you.
Thank you, sir.
Okay.